Probably just above 90% Latino, and a number of probably about 8% African American.
Mm-hmm.
And we've been doing some outreach because we realize now with the economy as it is that there's a new uninsured, and it may be people who know nothing about community health centers, or that our doors are open regardless of ability to pay, regardless of race, regardless of any of that. And so what we're doing is some special outreach, and any time we can appear on programs like this one, like yours, or anywhere to say, please, you know, whether it's Los Barrios Unidos Community Clinic or whether it's the Martin Luther King Family Clinic, no matter what, if you are uninsured right now and you are struggling, please bring your children, please bring yourselves, and don't stint on your health care.
That is extremely valuable, because many times when people become unemployed and lose any benefits that they have, they're hesitant to go for care because they can't afford it. And so to know that this is available, it helps the general public because it keeps communicable diseases controlled.
That's right. We keep kids in school. We keep kids healthy. We keep dads at work. We keep moms at work. We do everything we can to shorten the visit. In other words, they're not there for all day. They're not there 8 hours or 10 hours or 12 hours like they would be in an emergency room. So we do everything we can to shorten the visit, have lots of time with the doctor, but do what we can to shorten the wait. So that we can get kids back to school, so that we can get moms and dads back to work or back home.
And are you tri-levelly funded? You get federal, and you get what?
Federal, state, and local.
And local.
And we receive.
And then you raise money.
Right.
Yes.
We just recently received a little over $500,000 from Crystal Charity Ball. So now we're going to be able to provide specialty pediatric dental services within our facility. It'll allow us to hire an additional dentist and a dental hygienist and some other staff, and we received other funds for renovation.
Dental service is extremely important for our young people, because they can get dental caries and have heart conditions, all kind of other illnesses.
And we know people have died, children and adults have died from infections in the mouth. The body's all related, but everyone doesn't understand just how important it is that they get that prevention, and if there is some kind of pain, that they have it addressed immediately instead of waiting until they really can't function very well, or the kid constantly misses school before they actually come in to be seen. So we really try to do whatever we can, go to schools, and we talk to parents and get the word out to let them know that we're available. Our hours are available, are much more efficient, and our hours are designed in a way to respond to what patients say that they want. We do patient satisfaction surveys to find out what their needs are. When do they want us to be open? Where do they want us to be? So we try to respond in any way we can.
Well, that's tremendous.
We've also,
and I see you shaking your head, so you agree with all that.
Absolutely.
We've written a grant to expand our mental health care as well. We want to integrate mental health care with primary care, because we understand that often when somebody may be struggling with postpartum depression or depression from diabetes, that it would be the primary care doctor that might be the first place to recognize. So we want to integrate mental health care with primary care, and that's another thing. I don't think that community health, most people, if they even know community health centers exist right there in Dallas for anybody who's facing economic difficulties, they don't understand just how many different services we provide, which is convenient for a parent to know that mom, dad, the children can go to one place. It isn't as if you have to take off work and you run to one doctor in one place and one doctor in another place and a pediatrician in another place. It's all under one roof. So.
Oh, that's great.
Yeah.
And I know that you're bilingual, which really.
That's absolutely.
Yes.
Absolutely. We're very proud to say that we speak English and Spanish. We also can make arrangements for if someone speaks yet another language or American Sign. We make arrangements for that. So really, truly, everyone is welcome at our clinics. We really feel like we're in the business of access. We are improving access, and we don't want something like not knowing their language to be a barrier. So we really strive to understand our communities and be sensitive to the needs of our community.
About how many people do you serve a year? Or
we see, in 2008, we saw 21,000 patients at our West Dallas clinic.
We had 20,000 visits from patients. We have about 7,500 individual users, but they come often throughout the year. So we had a little over 20,000 visits.
That's a lot of visits.
It is, and you know something, we realized that we know it's not enough because there are patients who have chronic diseases and they don't come as often as they need to because it could be they don't have enough money or they don't have the transportation. So we try to accommodate them by paying for the taxi if they need to come and come in. And we try to do things a discount or even set up services where they can get their medications for free. Our goal is to be able to get a lot more patients healthy and keep them from getting sick.
Yes, the mental health component is very important. The majority of the people that are homeless really need care. And, you know, they'll go to an emergency room when they're sick, but as soon as they leave that emergency room, they don't have access to keep the wound clean or whatever else they have to do. Plus, you know, to be homeless is really a very emotional situation, take a really emotional toll on people. So adding that component would probably be very, very important.
Fortunately, where we are, we're in the King Center, and the building right next door has Dallas Metro Care. So they're just that close where they can either come over and take care of the patient while they're in our center, or we can send them. We walk them over to make sure they get there and get the help so that they can go ahead and get seen and then come back to us for follow-up.
I know the beginning of our homeless population in Dallas came right after the lawsuit where the patient had a right to treatment, and they discharged a lot of people from the state mental institutions.
That's right.
And they left with medications, but they didn't keep them up, didn't know where to go. And so they ended up with behavior that was not normal because they couldn't get the medicine, didn't know how to really take care of themselves. And some of them actually had some family, but because of the behavior, they couldn't.
They don't know how they weren't
manage.
It wasn't easy to stay at home. We also, Los Barrios Unidos also has a partnership with Metro Care Services, Dallas County's mental health provider, in both of our clinics, including the new Grand Prairie clinic that you helped us open and get started. And so it's a really exciting partnership for us too. And that's another thing, that most community health centers, we're not nonprofit bubble in a bubble that operates alone. We learn how to partner with other organizations to deliver care and services. So we partner with mental health.
And we've learned that a good third of our patients that come through our doors for sore throats or diabetes or backaches or different things also have mental health issues. And it could be disabling depression or very troubling anxiety. And we have learned that they're not necessarily even going to talk to the doctor about that. That's a real skill to bring that out. They're going to talk about the pain, the physical pain that they're experiencing. They may not talk about the psychic pain. But we have learned to get some of that information out of the patient, and if we can train our primary care workers, and by that I mean our pediatricians, our family medicine, our internal medicine physicians, to look for those signs and symptoms, we know that compliance for their physical diseases and disorders will get much better. And on the flip side, I've talked to my colleagues on the mental health side, and many of their patients who come in for schizophrenia or for treatment for schizophrenia, for bipolar disorder, depression, have very troubling health symptoms. And sometimes it's their own symptoms that is a barrier to care. And so we really think it's a match made in heaven, partnering with an organization such as Metro Care, so that we are the physical health experts, and we can provide treatment to their patients, and they can help provide treatment to mental health treatment to our patients. So that it really is a new day of cooperation, even among nonprofits. So we're very pleased with the partners that we have in Dallas.
That is very important, because someone can have symptoms of an illness, a physical illness, leave, but if their emotional illness is not addressed, then it won't hold for long.
That's right.
Because the mental illness has a great deal of influence over the physical illness.
That's right.
And so, go ahead.
Particularly if the person who's suffering is the parent. And the caregiver who's taking care of the kids, or even having to be at work and take care of the kids. So we really feel that it's really important to address all of those needs. And when you can do that all in one stop, guess what? The patient will get better, and the patient will go back to work, and the kids will be in school.
Depression is a very common thing with impoverished people.
Yes.